If you are a group with less than 50 employees and fully insured, premiums are not controlled at all. They're controlled by the bigger group. However, if you're a group with more than 50 insured employees or on a level funded plan, you need to help control your premiums. Premiums are a very simple formula. Premium paid in, claims paid out. If you can control the claims part, you'll keep your premiums low. You'll be able to sustain it. Let's talk about the different ways that you can control your premiums. First of all, you need a culture of wellness. And let me just explain what that means. We don't bring in ooey-gooey bagels or ooey-gooey donuts in the morning. Instead, we bring in a fruit tray or we bring in something that is more healthy. By doing that, we create a culture of wellness. And that's an emphasis we want to have underlining your whole culture. There are a lot of ways that you can encourage a culture of wellness in your company. And while these may seem little, they can be very big. Let's look at annual physicals. Promote that, make sure everybody does that. Have your teeth cleaned twice a year. I am always shocked at who does not have their teeth cleaned. And if you're one of them that doesn't have your teeth cleaned, shame on you. We can see a lot of disease, we can see a lot of medical conditions in the mouth before they ever materialize anyplace else. Encourage your people to go to the doctor early if they have a medical condition. If somebody has a persistent cough for 6 months, what we want to do is get them into the doctor for that cough. What we don't want to do is find out they have asthma when they can't breathe and they hit the emergency room. And the emergency room. If we have information that says employees are going to the emergency room, it lets us start to educate our employees and say, do you really need to go to the emergency room? That's the most expensive healthcare cost there is. In fact, they should use Teladoc first, urgent care second, and if any one of those sends them to the emergency room, that's great. However, keep in mind, as we say in our family, you go to the emergency room if you're broken, bleeding, or dying. We don't want to say you don't go to the emergency room because it's so expensive. We just want to say that you use the emergency room correctly. Let's look at EAP programs, employee assistance programs. Most of our policies have an employee assistance program. We've just never looked at them before and never used them. What that is where employees can call confidentially and get help with both mental, financial, parents, any type of those conditions that come up. That's very important in today's world. A couple of other items that we need to think about when we're working with our employees. Smoking cessation. Smoking is very, very expensive to a health insurance policy. The different things that develop out of smoking. First of all, as an employer, I hate giving them time off to go outside and smoke. 15 minutes, 15 minutes, 15 minutes, and they all go out together because they've got buddies. We actually do have companies that have a surcharge for people that smoke, and that's not uncommon. The other thing that I look at is promoting physicals, your annual physicals. You can actually promote physicals within your company. In other words, you want them to have their physical. We never know what they're going to catch early. If a woman has a mammogram, she might find a lump. We get it early, we have no problem. We find out it develops over time, and now we're at stage 4 breast cancer. All of this affects your premiums within your company, and all of it affects your employees and their attitude. What we want to do is make sure we have give employees the very best opportunity to stay well, which also gives them and us the very best opportunity to control your premium costs. This is applicable to groups with more than 50 employees, fully insured, or groups using level funded. It again does not matter if you're fully insured group with less than 50 employees.